PSD, a platform where we think, speak, and discuss. My name is Nyasha Sharon. As we commemorate World Cancer Day 2024, the theme remains the same as for last year, which is #Close the Care Gap. A very relevant theme for us, particularly Zimbabwe, where the further you go from towns and cities, the less access you have to healthcare facilities. And whilst we are grateful to the government for the recent strides that it has made with improving and increasing healthcare facilities, primary healthcare facilities in marginalized areas, a lot still needs to be done to improve healthcare access in the country. And as we commemorate World Cancer Day 2024, my particular concern and focus is on a cancer that is prevalent, a cancer that mostly affects women and the leading cause of cancer death in Zimbabwe, which is cervical cancer. And so I'll just speak briefly to this cancer. Cervical cancer is it's a cancer that occurs on the mouth of the cervix, which is the opening of the uterus. I'm not a medical doctor, and I do not claim to have much knowledge with regards to the medical aspect of disease. And so I'll refer you to, I'll post quite a number of links that give detailed medical information with regards to cervical cancer. But the little that I know, which I've had interface with maybe during discussions with others or during mostly research, is what I'll share. But I'll still post the information in the link to this video so that we are as informed as possible and that we can share the information with others, other women and men also, so that the information cascades to various members of society. And so cervical cancer, one of the risk factors of cervical cancer, one of the leading causes of cervical cancer is HPV. And from what I've researched, HPV strains, there are many HPV strains, but particularly HPV strains 16 and 18 are the most likely to cause cervical cancer or invasive cervical cancer in women. And what causes HPV? HPV is found in people that are sexually active. It's found in both men and women do have or can have HPV, and it is very likely that having had sexual contact, a person is very likely to harbor a strain of HPV within their body. But it is not all HPV strains that cause cervical cancer. But because of the prevalence of sexually transmitted infections in Zimbabwe, because of the prevalence of HIV and AIDS statistics in Zimbabwe, it is recorded that in the world, Zimbabwe ranks number 6 in terms of HIV prevalence rates. And also with regards to HPV, Zimbabwe ranks quite highly. And so this speaks to a culture and a social aspect within the country that has to do with sexual activity. And so because of sexual activity, the rate or the likelihood to contract HPV strains, and particularly those that cause cervical cancer, is very high, and therefore increasing also the likelihood for one to then contract, or for women to then contract, cervical cancer. And so which is why this particular cancer is very close to my heart. Issues such as maybe limited access to healthcare, lack of awareness, or cultural, societal factors, where it is kind of taboo to talk about sexual and reproductive health, and also maybe because of how we, mostly religious society. I mean, like on the face of it, we attend we congregate, in our various religious circles, whether it's Christianity, Muslim, and, other even traditional religions, we congregate generally as Zimbabwean societies. And unfortunately, in these societies, there seems to be a taboo to talk about sexual and reproductive health. And so certain issues, that even though are common to the many families and the many couples and in sexual and other intimate relationships, the less, unfortunately, the likelihood that we talk about the issues that affect us as a people. And so I'm just, coming to you viewers on this particular World Cancer Day and urging us to open up more, as a people. Let's talk about these things. HPV is spread through skin to skin contact. And so it does not even necessarily have to be, particularly, the more intimate kind of sexual contact, but just skin to skin contact increases, because they're likely to be, whether it's lesions, on the skin, the genital area, and this then, increases the incidence, the likelihood of one contracting HPV. And if one contracts an HPV strain that is, one that causes cervical cancer, and then it increases the chances of one causing that contracting cervical cancer as a woman. And unfortunately, because males are the dominant partner in sexual relations, it is very difficult for the woman to then come out and say, I'm not in a position, to have sexual relations because I fear that I may contract HPV, which may result in me contracting cervical cancer. And more so when, one is multiple sexual partners, because then that also then, cascades the whole cycle and likelihood for one to then bring to their partner an HPV strain 16 or 18 that is likely to cause cervical cancer. And it is just, one of these things that we need to think about as a society, discussions that we need to have, and, discussions that empower the woman to be able to say, no, I cannot have sexual relations because of these particular factors. I need to protect my health. I need to protect myself. And then the other thing is one of the other factor that can increase the likelihood for one to contract cervical cancer is when one already has a weakened immune system. And so because Zimbabwe is already ranked number 6 in the world with high HIV and AIDS prevalence, so it means also the number of people in the population, in the adult population, I think it's said to be between 11 to 13% of adults living with HIV. And so already that high number then means that a lot of people have weakened immune systems. And when somebody has a weakened immune system, and this is coupled with then having contracted an HPV strain that causes cervical cancer, it increases again the risk of one then, likely to actually contract cervical cancer. And so again, this is one of the issues, one of the factors that cause cervical cancers. There are other factors. It's said smoking, and some I may not be able to state them, but again, in the information that I'm going to post in the link to the description in this video, will also show the other likely possibilities, of factors that can cause cervical cancer. But the two that I've mentioned are the ones that make it or that give light to why Zimbabwe then is one of the highest incidences of cervical cancer, and why cervical cancer is one of the highest cause of death amongst women in Zimbabwe. Multiple sexual partners, weakened immune system. And weakened immune system, look, it's not just HIV. There are other, can be chronic diseases. Cancer in particular can weakens the immune system, and so can also increase one's chances of then being infected by cervical cancer. If they then have contract that particular HPV strain and they already have a weakened immune system. And then there are also other diseases and maybe even other issues, particular issues, maybe that have to do with maybe even other socio-economic factors, such as stress-related issues. They can actually weaken one's immune system. So, all those are factors. And I just wish and hope that, just by starting this discussion, it can set off, a wave of discussions amongst ourselves, so that we realize the need for women to be empowered. We need to be empowered to make our own decisions regarding our own sexual health. Our sexual health must not be controlled by the partners within our lives. And we also need to realize that, just because cervical cancer is linked to sexual relations, it does not mean then that because a woman has been diagnosed with cervical cancer, it means they're promiscuous. It's not necessarily the case, because as I said earlier, HPV is not just found in women, it's found even in their male partners. And so even when a male partner has multiple sexual partners, the likelihood then of them bringing in a specific HPV strain that can then result in their partner, whether it's their married partner or their long-term partner, to contract cervical cancer, it's increased. And so let's shun away from the stigma, that then makes women not want to go out and to go forth and get screened and get tested for cervical cancer in its early stages. Let's just do away with that stigma. And then also I would also urge our healthcare practitioners, our public healthcare government even, to introduce an HPV vaccine for men. Right now, the vaccine was introduced, I think, in 2014 for girls. I think girls up to the age of 15. So if the net can be cast wider, one for the men, so that the men also, if they're vaccinated against HPV, it reduces the likelihood of them then catching a strain and passing it on, to their sexual partners. And then two, if this vaccine can also be, the age range can be increased so that it goes beyond 15 years, because I'm sure in developed countries, women can be vaccinated even as far as in their 30s, and I think up to the age of 45. So if measures could be put in place, for funding, so that the range in which women can be vaccinated and even men also can be vaccinated for HPV is increased, and thereby reducing the likelihood for cervical cancer incidences in the country, and hopefully reducing the infection rate of cervical cancer within Zimbabwe. And so I hope this sets us thinking, so that we can talk about it amongst ourselves, have discussions with those in our circles, and hopefully reduce the incidences of cancer, cervical cancer in Zimbabwe, and increase our awareness, our knowledge, and our cultural behavior and social behavior as well with regards to cancer. So let's close the care gap, and until next time, let's think, speak, and discuss. Cheers.